Welcome to Webinar Wednesday. We've got a great presentation for you today featuring Samuel Hill, Director of Product Marketing for Medigate. Webinar Wednesday would like to thank our sponsor, Metagate. Metagate provides award-winning cybersecurity for connected devices and hospitals. The platform combines a deep understanding of manufacturers' protocols and clinical workflows with cybersecurity experience to deliver comprehensive and accurate identification, contextual anomaly detection, and clinical policy enforcement. The resulting automated rule-based and clinically driven security policies keep patients, networks, and PHI safe. For more information about today's sponsor, I do want to encourage you to visit their website. It's metagate.io. And we recently hosted the 20th anniversary of MD Expo in Atlanta, Georgia. We were joined by over 700 attendees and vendors for 3 days of education, networking, and fun. While we were there on site, we did have the opportunity to hand out these really cool 20th anniversary t-shirts. We have a few extra, and I thought today would be a great opportunity to give a few away. So attendees, using the question feature on your webinar dashboard, I'll mail a long sleeve t-shirt to the first 2 people that can tell me the name of the location for the first MD Expo. You can tell me the name of the location, you can tell me the city if you remember it, but the first 2 people will receive a long sleeve t-shirt that commemorates our 20th anniversary. While you're busy Googling the answer, I do want to share that the next MD Expo is going to be October 11 through 13 in Temecula, California. You can find more details online at mdexposhow.com, and we have our call for presenters up right now. So if you are an attendee and you've got a great class or educational lecture that you'd like to share and propose for that conference, do visit the Become a Presenter tab on mdexposhow.com. Okay, today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your CE certificate from the ACI, and you will be able to download the certificate directly from your computer or electronic device once the survey is submitted. If you have any questions or issues, you can always email us at webinar@mdpublishing.com. As I mentioned earlier, our presenter is Samuel Hill of Medigate. Today, he will outline 5 of the most common outcomes from improving device effectiveness. Samuel, you may begin whenever you're ready.
Hey, thank you, Jamie. Hey, I was honored to have been able to participate in the 20th anniversary of the MD Expo show. What was it, a week ago now, a little over a week ago, there in Atlanta, Georgia. And I have one of the t-shirts, so if you answer that question correctly, you're in for a treat. Those t-shirts are really fun. But hey, today we're going to talk about some of the benefits we have seen by helping biomed improve the effectiveness of their devices. You know, we have thousands of these devices that are all over our hospitals. Each of these devices cost thousands of dollars, and they, patient care relies upon them. We cannot get a patient through the hospital, it seems like, without some medical device touching them in some way or another, which means patient care doesn't work unless these devices do, and these devices don't work unless you guys do. And you guys are already busy enough, and so we want to help make your lives easier in some ways to make these devices more effective. I spent 7 years in my career early on as an emergency room technician, as a patient care technician in the emergency room. And I remember many nights when I would have to go hunting and finding for these medical devices. And it's, we all know that there are so many of these devices and they all do different things and sometimes have different names. And I remember it's not uncommon for a nurse or a doctor to say, can you get me something? And they'd rattle off a name. And it was not uncommon, even if you'd worked there for years, it's still not uncommon for you to hear a name that you are not familiar with. You're like, wait, what is that? And then you have to go figure out what that is, ask around, ask a friend, ask the doctor to clarify what it is they're actually wanting or needing, and then go find that device or that tool or that instrument. I remember one night, one of the doctors, and she was kind of new to our emergency department and, new to working with us. And she said, "Hey, can you go get a Johnny for the patient in room 5?" And I looked at her sideways. I was like, "I'm sorry, ma'am, what is a Johnny?" And she had to explain. I worked on the West Coast. On the East Coast, they call it Johnny. That's a patient gown. I had no idea. But once I understood what it was, I was able to go find the gown, get it to the patient, and we were able to continue on our merry way. Other nights were a little more interesting, where we would run out of certain tools like IV pumps, and I would have to go walking around the hospital floors and other units, like medical surgical, and collecting unused or IV pumps that were not in use at the time. I would load them onto the IV pole, and I would begin walking that IV pole down to the emergency room. You always had to pass the nurse's station. I would kind of wave at them a little bit, and they didn't wave back. They didn't think that was very funny. But these devices are critical for patient care. If we don't have them available for the frontline staff, they're not able to do the jobs and do the work that patients come to our hospitals and trust us to do for them and for their families. So that's why, if we can help improve the effectiveness of these devices, we can help make the lives of our frontline staff easier, and the lives of all the hardworking biomeds that spend their energy at work making sure these devices are available to the frontline. So today we're going to talk about a couple different things. We'll review some of the life cycle challenges from what we see. I always hesitate a little bit telling practitioners of biomed. I always hesitate telling you what your challenges are. I don't like that. So what I'm going to do is I'm just going to review some of the challenges as we see them. If you disagree with these challenges, drop a question, drop a comment in the webinar here. We can discuss it. This is kind of what we've seen in consultation with our customers and clients and other biomeds across the industry. And you're welcome to disagree. I don't want to presume that these are the only challenges. We'll talk about some of the realities of biomed today. I have some statistics and some measurements that we have collected that I'll share a little bit with you on, and we can discuss how that affects you and why the need to be more effective can really have significant downstream impact. And then some of the top benefits. We'll talk about some of the things that we've seen our clients achieve by using data to better optimize their workflows and the things that they're doing. So some of those top 5 benefits, I've got them listed there. And at the end, we'll always, as always, have time for questions and answers. So let's dive into some of these challenges. We believe that healthcare is challenged by poor medical device data, and this affects security and operations. The challenge is not people. The challenge is not necessarily the devices themselves. In our opinion, the challenge is about the data around these devices, knowing what the devices are. In my example of knowing what a Johnny is, it's a patient gown. Once I knew that, I had data, I was able to get the job done. We needed better data. And I think that's what we're challenged by, poor medical device data, which again, in our opinion, affects security and operations. So Metagate built a leading platform so we can improve the effectiveness of every device. This platform collects data off of your network. It positions an incredible treasure trove of information about the devices, which we'll talk about here in just a little bit, so that you can better manage the life cycle and the workflow that you have every single day. So here's some of the challenges that we're seeing biomeds face on a day-to-day basis across the industry. And again, I am not sitting here trying to say, these are the challenges, this is what you're facing. I know that's naive of me to say. If you agree with some or all or none of these, do let me know. Love to have that conversation. But one of the first challenges that we've observed is that your CMMS, its data is hard to keep up to date. The moment it moves in the inside of the hospital, the data is difficult to keep up. And finding the information on the device itself, it takes a number of different button clicks to get into the settings, to get into the device ID settings, and all of those different pieces of information that you want to input into your CMMS. It's time consuming, it's challenging, and often it's just not done. The number of data fields that you need to enter into the CMMS, there are a lot of them, and they're all there for good reasons. There's very useful reasons to have that data available, but it's hard to keep it up to date. So challenge number one that we're seeing is your CMMS, and the data inside your CMMS is very difficult to keep up to date. We also know that preventative maintenance is time consuming. Being able to find all the devices, get them through the preventative maintenance checks and cycles that you need, it's very time consuming. But this is one of the primary responsibilities, is making sure devices are repaired, but also maintained and kept up to regulatory standards and compliance and all of those things. And ultimately it comes down to availability. This is what keeps devices available to our frontline teams for patient care. But it is time consuming. It takes a lot of energy and effort to make sure all of the devices that need are put through the preventative maintenance cycles that are required. Par leveling can be semi-ineffective because we have, a stated number of devices that are supposed to be on a certain floor. But the reality is that's not always achievable. As I talked about in the emergency department, there were nights when, we should have had 150 IV pumps stationed in the ER. And I'm just throwing that number out. I don't know what the actual number was, but we have a certain number that should be down there, but we ran out for a whole host of reasons, and we needed more. So the par leveling wasn't keeping up with the actual demand and being able to keep assets moving around the hospital, especially the mobile ones, so they can be where they are needed, when they are needed. At many hospitals, device leasing is a strategy that they've employed to make sure that they are able to keep enough devices on hand and in inventory. So instead of buying them outright, they'll lease them either for surge periods or on demand or whatever that is. But the leased devices, there's an overabundance of them. This is a costly method to acquire and maintain devices. And so having more of them that are on a lease than you need, or if those leased devices are actually not being used, that's a significant problem. And we want to make sure that that's just money we're wasting in a lot of ways from our operational budgets. We've noticed in some of our hospitals that are reporting that lost or missing devices can still be in use. So we all know this happens where a device is marked as lost or missing in our CMMS because when it came time to find it, or it was due for preventative maintenance or whatever it was, we went looking for it. We could not find that specific device with that serial number or ID number. So therefore it's gone, it's lost, or it's missing. We don't want to have to keep trying to chase it down anymore. And we've determined that's not there. However, at times that device could still be in the course of patient care. It could be providing value, and that's a significant problem. If a device is not in our system of record, but it is actually out on the floor being used for patient care. So lost or missing devices that are still in use is a life cycle challenge that we've seen. And then the ubiquitous nurses hoarding devices. I know all of you have a story of that one weird place where you found a device that had been hidden by a nurse or a frontline staff, just because they wanted to make sure that they would have that device available for their use later in the day or later in the shift. And so hoarding of devices is a significant challenge. I've heard of crazy places like, I've heard of ceiling tiles, and I'm like, why would you put a device in the ceiling tiles? Like, you must be desperate to keep that device around. I mean, I can understand the under the sink cupboard, or a back corner somewhere, but a ceiling tile, that's crazy. But we know what happens. We know that nurses do this, and they have their reasons. Our job is to make sure that we don't give them reasons to feel like they need to hoard devices, so that they know when they need to find a glucometer, an IV pump, ultrasound, an EKG machine, whatever it is, that they're going to be able to in a timely fashion so they can get their work done. And so this is looking at, on average, some of the ways that we have found, and this is reported from, this is an approximation of a 1,500 bed system that has approximately 8,000 medical devices. And we did some observation, and we actually hired a couple of interns that came from a very well respected technology institute on the East Coast. And they helped us to parse some data from our customers and kind of this, abstraction and amalgamation of data. So this is not one hospital. This is actually an average of multiple hospitals. But on average, 1,500 bed system, approximately 8,000 medical devices. And the time that it takes for a biomedical engineer to manually add a device is about 21 minutes. 21 minutes per device if you're manually adding it to your network and to your system. And so that totals up to about 27 hours per year spent manually adding devices. If you need to update that device for any reason, whatever the reason would be, another 21 minutes. And then the updates take more because you're doing that more often. So about 70 hours per year spent manually updating a device. And you can see the similar trends for deleting a device from the inventory and from the system, or reassigning a device. We can see, again, on average, 21 minutes per device, with a total hours per year of 9 hours, excuse me, per year to delete devices from your system, and 91 hours per year to reassign devices in the system. It's a lot of time spent manually working with devices in with your CMMS. On average, it takes about 60 minutes to manually find a missing device. And most of your campuses I know are very large. In 60 minutes, you got to be moving pretty quick, I think, if you're manually finding a missing device. So that I'm not sure. I think that number is a little slow or a little fast, to be honest. I think it might take more time. And so on average, we're spending 1,300 hours every single year manually finding missing devices. The average time to close a preventative maintenance ticket, we've estimated it around about 2 hours, 120 minutes. And so if a preventative maintenance ticket is issued for a device, it takes about 2 hours to close that ticket. So that involves the finding of the device, the work to PM, to maintain it, to assign it, to do all the things that you need to do, about 120 minutes or 2 hours per device. Again, looking at an average of 365 hours a year. And then continuing on, the average time to process a manufacturer's recall, we also estimated that around 2 hours. And now I've been talking with some of our teams that work with the medical device manufacturers and have formed some alliances with them to help specifically on this process. And even our medical device partners are saying, yeah, that's really fast. So if you're notified about a device recall, you have to then identify all the devices that are in your network or in your hospital that are affected by that recall. And then you have to process it. Now you have to call the manufacturer, confirm the validity of the recall, confirm its impact to you, what next step do they have and do they recommend. All of these things are very manual efforts and take a lot of time. And so everybody I've talked to said 2 hours. I mean, that's very fast. So 2 hours might be a wrong average here, but if we go with it, spending about 73 hours per year tracking down manufacturers' recalls. And then the average time to reconcile rental inventory to return them and order them also sucks up significant time, about 60 minutes per device or 52 hours per year. And again, you can disagree with these averages or the amount of time. Most of you are probably faster at some of this work because you just are good at your jobs, but on average, this is kind of what we've been seeing, again, reported by our customers and abstracted across multiple different health systems for the averages that you're seeing. So there's a lot of time that we're spent doing manual work on top of all of the time that we spend doing the actual work of keeping these devices operational and within compliance specs. So again, you can disagree with these. Feel free to drop a comment or ask a question and we can talk about them more in depth. But this is a lot of manual effort. And in our opinion, this is what's caused some of the effectiveness gap, is that we don't have enough data. So we have to do manual work to work on these devices. So having better data is what will help us streamline or limit the amount of manual work that we are needing to do. So we want to improve device data. One of the things that I like to say all the time, and I do internal trainings for us at Metagate, and I always use the phrase, this was actually given to me by one of our salespeople who played in the NFL, and he's got a wonderful personality. And he basically is like, I just want to know the so what, who cares? So what, who cares? Why is this important? What's the big deal about this? I can tell you all sorts of information, but ultimately it has to come to an application point. So why would improving device data help with the effectiveness of these devices? So what, who cares? We've got work to do. By improving device data, we're actually talking about getting a very accurate and holistic picture about the device itself. And this will become more important as we continue this conversation. So this right here is a look at a packet, a network packet. It's got an encapsulated coding that talks about the different things that are inside of this packet. This is actually from a Draeger patient monitor. And we're looking at different things around the IP address, the network address, what is inside of this packet, all of this different data. And what Metagate does, we actually open up this transmission and we look at all of these little hex codes and numeric codes and values, and we understand the language that the device is speaking. So we actually understand what all of these numbers and letters mean and can tell you an incredible amount of data about that device. Even down to things like the operating system name, the version, the version code string, the host model, all of this different stuff where we're able to give a treasure trove of information about the specific device. And where that begins to play out from a biomed perspective is you're now getting a near real-time feed off of the network traffic itself about every single device that is communicating on your network. And where that is useful is now we'll be able to see in real time, near real time, what devices are communicating. And so you can do a lot of great things with that data from a biomed perspective. This is what that device profile looks like inside the Metagate platform. We see a lot of great information about the device ID. This is actually an Alaris 8015 PC infusion pump. And we look at this and we see that it has on the version names, we have it as a proprietary Enia OS E, so the operating system. It is proprietary, so it is written and custom built by Alaris or by Zebra or any of those companies that work on this proprietary software. And we see the application version. This becomes very crucial when we look at things like vulnerabilities and exploits and being able to confirm that there is a recall or a vulnerability or something that is affecting the devices, being able to tell down to the application version or software version what is in these devices makes your life a lot easier as a biomed to say, oh, I can tell you what devices are effective. Or if you're having a regulatory compliance check and they walk up to you and say, so tell me about this device here as we're walking past it. You're going to be able to pull up and tell everything about that device, including obviously all your maintenance history and records of it, but including all the different vulnerabilities and the things that you've done to secure your network that your security peers care about so deeply. We also see things in here around the network security and the network connectivity of it. And what that does is it gives us an ability to triangulate the location of that device. So looking at here, there's a little spot here on the towards the middle on the left side of the screen where it says AP location. And we're looking at this, we're tracking that this medical device, this infusion pump, is communicating on the network to this specific AP location. And if I were to click on that hyperlink, there usually is a hyperlink there. It's not in this because this is a slide. But clicking on that hyperlink will bring up a map of your building and show you the blue dot beacon where this device is. So now we're going to be able to say, we know where this device is communicating from, physically located inside of your network. And then also the interconnection with your CMMS, or if you're using a CMDB for whatever reason to manage some of these assets, which I don't know why you would, but your CMMS is going to be also communicating information about the device. You know, what is the service state of it? It's in service, it's asset tag number, it's hospital owned, it's supposed to be in the heart tower. What room is it supposed to be in? These different pieces of information that then come from the CMMS itself, including unique device ID or other attributes that you hold there as well. So some pieces of data that will help us make better operational decisions about these devices and what we can do with them. This is what the Metagate platform looks like at the very beginning, and we see just a real high spectrum view of everything that's connected and communicating on the network, including the manufacturers of devices. We see Alaris there in the middle, the top middle, Alaris and GE and Apple and Welsh Allen and Centrac and Roche and Cisco and all of these manufacturers that are communicating on the network, the different languages and protocols that they're speaking, other devices on the bottom left there that are affected by different vulnerabilities or have alerts against them, and then looking at different types of high risk or device type families. So the Metagate platform is what's presenting and showing this incredible treasure trove of information about all of these devices that you can use to make some incredible operational decisions. So using all of this data we have about the network, I have three things that I believe it helps for biomed, three kind of core value addings for biomed users in general. The first one is around inventory accuracy, the challenge of keeping your CMMS up to date. We're now going to take a near real-time feed from the network itself, basically what all these devices are saying about themselves and identifying themselves, and communicate that and populate all of those fields in your CMMS. Now, of course, you can confirm and validate. You can make sure that any corrections are needed. And additionally, we have worked out some logic to make sure that we can actually match. So if your CMMS field says you want the data in this nomenclature, but the data coming from the network is at a different nomenclature. We can reconcile and match those pieces, so you're not getting a bunch of mismatched data being populated across the different platforms. And this data now becomes easy to keep up to date so that your CMMS inventory will be as accurate as possible, and you don't have to spend all that extra effort manually inputting all of the data that is coming off of the device. So your inventory, because of this improved device data, your inventory will be highly accurate, which will lead to many of the benefits that we'll talk about that our customers have seen from better data. The second piece of information that I think is crucial for biomed is the physical location of the device. Where is this device? You know, being able to integrate with the network management and report the physical location, what it does is it narrows your search area. If you have to search a very wide, large area, narrowing it down in any way will help you to identify where the device is. If I told you the device is on that campus, you would say, okay, that helps. I'm glad it's on that campus and not on, you know, the 3 or 4 other campuses that we have. That's a good start. But if I told you it was on that campus on floor 5 in the med surgical wing, you would say, okay, that's even better. Now I know where to go inside of that campus. But if I told you it's beaconing somewhere about here, or it's in this room, now you're down to a room level where you can walk in. And I know you guys know all the hiding spots. You guys know how to find these devices, what they look like, and what you're looking for. Finding a device in a room is much easier than finding a device somewhere in a hospital. So we make the haystack very small for you to go looking for it. The third piece of information that I think is really important for biomed, that helps them significantly, is tracking how often these devices are utilized. You know, we say on average, this is what we've seen, on average, a medical device sits idle 52% of the time. And so, you know, we don't want to be used 100% of the time. We obviously need to have availability. So if every device is fully used all the time, then we don't have enough devices out there. But 52% of the time where it's sitting idle, I think we can improve that a little bit. And so being able to track and actually have a real understanding of how often devices are used will help us make great operational decisions about many things surrounding the device lifecycle. And also things like, when would be the best time for us to grab that device off the unit and take it down to our workshop and do the PM that we need? Well, maybe the time when it's not highly used, or it's not currently in use, or all those criteria that you can then have better data around, so you can know and plan your workflows. You know, hey, the MRI machine is not used very often, about 2 a.m. Well, maybe that's the right time to give it some downtime and do whatever updates, patching, PM, whatever needs to happen for that device. So utilization tracking is a very important piece of data that can really help improve the effectiveness of devices. So now here's some of the top benefits that we have seen from improved device effectiveness. The accurate data in the CMMS. We spoke about that as something that's really, really important. And so, you know, I was talking with somebody at the MD Expo show actually, and they were relating how many data fields are in the CMMS that need to be filled out, and how often. And he's like, you know, this is just a known thing. We don't have the time, and we skip it. We're not supposed to necessarily. We're not maliciously trying to make things bad, but we skip the data fields at times in the CMMS because it takes a lot more of your time than you actually really want to do. And so we actually we have integrated significantly with all the major CMMS players, and we send data back and forth. So the real-time things coming off of the network itself can be populated into your CMMS so that your data will remain as accurate as possible. And what that does is it gives you, again, a complete record of truth about the devices in your environment. And having that complete record of truth, now everyone else in the hospital can trust that record of truth, knowing it is continuously being updated, accurately being updated. And it's now something that we can look at and say across our entire system, now what decisions should we make? How should we best life cycle these devices? Or what other pieces of input do we need or should we look to make some of these decisions? One of the second benefits is around the biomed time savings. We had a customer and they were relating to us how, you know, every time it came for PM for a device fleet, they said, you know, it's pretty typical. We can't find about 10% of the devices. We find 90% of the devices we need to, and we get them through the preventative maintenance, but there's typically 10% of our fleet that we just can't find. It's somewhere, we don't know. And they estimated, it takes us about 500 people hours to go through the whole hospital to find that remaining 10% of devices. And you could, if that's a real experience for you, let me know. If it's not, if you find it's easier or harder than that, please let me know. But what they found was that with having this data available to them about the devices, including the location of the device, that 500 people hours time was reduced down to 2 hours for them in their health system, because they knew that the haystack got smaller. They were able to go search more effectively for the devices that they were needing to find to get through the preventative maintenance. And we all know you're overworked as it is. You have more work on your plate than you need to do. So anything we can do to bring some time back into your work life is usually helpful, because there's a whole backlog of things I'm sure that you would love to get to if you could just make sure you were getting all the data you needed about the device, so you can get through the systems and the workflows that you need to that are already on your plate. One of my favorites to talk about is reducing the annual device spend. Now, we have seen this multiple times from customers where, and in fact, one of them said they had a request from one of the frontline care units, like a nursing unit, and they said, we need more devices. And so the team was like, we need to buy 700 more devices, more IV pumps is what they were looking at specifically. They looked at the data coming off of the network and saw, we have this many devices and they're wanting 700 more. On average, a medical device, not talking about heavy iron here, but a medical device costs about $3,500 on average. So 700 new medical devices is just over $2.1 million to buy new devices. And they realized, you know what? We don't need to buy 700 more, because we have devices that are either in storage or are not being used as heavily in other units. And they were able to redeploy and reallocate portions of their fleet. So it was a win-win on both sides. The nurses, the frontline staff, they got the increased number of devices that they needed for their particular unit. And the hospital was able to avoid a little over $2 million in capital expenditure to buy new devices. And all of this came because they were able to look at the data coming off the network, track the utilization of devices, track the location of the devices, and began to realize that we can more effectively deploy and utilize what we already have. And this was a significant advantage for them, and they were very grateful for that improvement. Improved device availability. This is kind of why we do what we do in a lot of ways. Like, at the end of the day, we need to make sure these devices are available to the frontline teams to deliver patient care. One of our customers was an academic medical center, actually on the East Coast. They were looking at the data on their network, and they realized that they had 3,000 devices. They're a very large academic medical center, but they had 3,000 devices that had not connected to their network in over 6 months. And what that means is those devices had not been turned on in over 6 months. So you can imagine, as all the requests, all the issues, the nurses are complaining about availability, all the things that are happening, that we need our devices more, we need them more available. And they realized that there were 3,000 just around that had not even been turned on. So they were able to locate those devices, they were able to get them turned on, get them through any of the regulatory checks that they needed, make sure they were up to date. And now all of a sudden, seemingly overnight, thousands more devices were available to their frontline care staff so that they could do their jobs. And this is a significant improvement. These devices became more effective because they were simply turned on and made available. And the final piece that we've seen as a benefit for our customers from improved device effectiveness is being able to look at the need to acquire new heavy iron, like new radiology devices, CT scanners, MRIs, PET, C-arm, all these big expensive machines that are foundational and formative to healthcare delivery. One customer actually was able to see that they had I believe it might have been a CT scanner. I'm blanking on the specific heavy iron device. But they were able to discover that their radiologists were asking for a specific procedure. It was something they were doing very regularly. They didn't have enough device availability, didn't have enough device time to perform all of the procedures that were needed, all the scans and studies that were being asked. Their patient demand was high, but their availability, their just workload availability from these machines was not. They had another device, and they were saying, well, we need to buy yet another. But they found they had a device already, a CT scanner already in their environment, that with a simple software code upgrade could become available to do the scans that were needed. And they knew this because looking at the device data, looking at the software versions of the devices themselves, looking at the capabilities for upgrades and management and all that stuff, they realized with a simple $10,000 software upgrade, which is something still, but they spent a little bit of money and they avoided having to spend the millions of dollars to buy an entirely new device, the construction costs to put that device somewhere in their hospital, and everything else that goes along with it. So looking at your heavy iron, your radiology devices, how often they're being utilized, what scans and studies they're doing, their software versions can help you plan the capital expenditures for these really big devices. And all of these hospitals saw millions of dollars of savings returned, or operational budget returned to their hospital. And what they did with it, it's, I don't know exactly, but imagine being able to tell some of your budget controllers of how we can save money and return money back into their operational budget because we're going to better use the devices that we already have. So those are some of the top 5 benefits that we have seen from our customers. And again, you might see others, you might have experienced others, and if that's the case, I'd love to hear about that from you. But that's kind of what I have had to share with you guys today, and I really hope that you guys have found some value in this. We're going to go now to the question and answer portion of today's presentation, and I'm looking forward to the questions that have been submitted by you, our members here. So Jamie, looking forward to what questions have been populated.
Well, we've had quite a few that have come in while you were presenting today, Samuel, but before I jump into the questions, I do want to remind all of the attendees, you still have the opportunity to ask some questions. Use the question feature on your webinar dashboard. You can type them in at any time, but Samuel, let's jump into it. One that came from the attendees is just a quick explanation. What does PAR stand for?
Oh, sorry, that's a par leveling. That's what I've always known it as. It's basically, I actually don't know what PAR stands for. I'm sorry, that's one of those acronyms that I've just heard so many times that I remember as a patient care tech we would use. It basically means the number of devices that you should have available for a specific location. And it could apply to things like medical supplies, how many IV kits, how many, blood vials or medicine bags, or all the different things that are stocked in, different areas of the hospital. So and the way I would use that term is to describe how many of something should be in a specific area. That's a standard measure of saying we should always have, 100 of these things in this part of our hospital. That's what I would call the PAR level. Your hospital may call it something different.
Wonderful. Can you specify what is medical device data?
Yeah, absolutely. So what we're looking at is the data that the medical device communicates about itself on the network. So it does include some of the pieces of what it is doing, like the specific work that it is performing. But what we're mostly interested in is what does the device say about itself, and so that we can then track it and then use that information to update systems, namely the CMMS, specifically in the biomed use case, with the accurate data about the device itself.
I love that we got some clarification from one of the attendees. PAR levels are periodic automatic replenishment. There we go.
There you go. There we go. Now we know.
Right. I love that. We're learning together. All right. Next question. Is it possible to use Metagate to pull MAC IDs from connected equipment?
Yes. The MAC ID is a unique, or should be a unique identifier for the device, and for the device itself, and also for the serially attached. So the common use case would be an infusion pump and the sidecars or the modules that attach to that infusion pump. We can see the unique MAC IDs of each and every one of those devices, and we report that into the system itself.
Good deal. What CMMS platforms do you use? Oh, I'm sorry,
Yeah,
wrong question. How do you connect to a CMMS?
so we work with all the major CMMSs, Nuvolo, Ames, Metamizer, all the major ones that we've seen out there in the industry. And we use what we call an API, an application programmatic interface that sends information. We send information to the CMMS, and the CMMS sends information back to us. So it is a bi-directional API connection is how we work with all the major CMMS players.
Can you use the device profile to help with security?
Yeah, so this is one of the fascinating things is Medigate started as a security company. We started using all of this data we collect about these devices to help security teams in healthcare better manage these unmanageable devices. For a medical device, you can't put like a piece of security software. You can't just put a security software on these medical devices. It's not possible. So they're called unmanaged assets in a lot of ways. So the security team, they need a lot of data about them so they can better enforce some of the security postures and policies that are really needed. Anything that connects to the internet presents an attack risk to a hospital. And in today's climate, attack risk is significantly high for every hospital all over the world right now. And so every attack vector has to be managed in some way. So originally, Metagate got our start because we were delivering all of this really robust data about the devices to the security teams. And as we grew, as we realized another value we could bring to healthcare was using that same data to help biomeds ensure their devices were operating at maximum effectiveness. So this use case is actually something that we've developed and have seen significant value in our customers from. They've asked us to deliver this because we got our start in security, providing this data to the security teams.
Samuel, you said you see all the devices. What are some examples of the devices that you can see?
So we break them into kind of four main, like just general classes of devices. You have things like your IT devices, the servers, the network switches, the wireless access points, the different pieces that IT typically manages and owns. Then we have other classes that are like IoT, Internet of Things devices. They could be something like an Apple smartphone that a nurse is using for nurse call, or Vocera badges, or just different things that are IoT devices that are Internet of Things. They're internet connected, they're a thing, they're doing a specific job or a role. And the other classes would be what we're looking at as we call operational technology, the things that run your facilities. Think about your HVAC controllers or your building management systems, building automation controls. If the elevator system went down in your hospital, that's all being run by machines in a way. It's all being run by OT devices. But if the elevator system went down, we all know how hard it would be to do the jobs of healthcare. And then the final class, we would look at what we call Internet of Medical Things, medical devices themselves, what we historically know and have worked with specifically. So when we say we see all of the connected devices, we see every connected device that communicates on the network, and we help provide a profile and some rich data about each and every one of them for their specific use case and in their specific context.
Fascinating. I have really enjoyed this. Thank you, Samuel. It was a great presentation. I'm going to circle back quickly to the fun fact question that we asked before the beginning of the presentation. Attendees are asking what the answer was. The very first MD Expo was held in 2002 at Callaway Gardens in Georgia. We would have also taken Stone Mountain, Georgia. I think that's become synonymous for the first MD Expo. So just fun fact for trivia later. I do want to encourage everyone again, please visit the sponsor's website today, Metagate.io. If you're not familiar with this company, spend some time on their website, learn more about the services that they're bringing to our industry. One last quick reminder, you can obtain your CE certificate by completing the post-webinar survey. The survey is emailed to you 1 hour after now. You must complete this survey to receive your CE credit from the ACI. You'll be able to download your certificate directly from your desktop or mobile device. And if you have any questions or problems, you can email us at webinar@mdpublishing.com. We'll be back next week with another great webinar Wednesday hop over to webinarwednesday.live to view the upcoming calendar and register for that event. All right, make it a great week. We'll see you back on Wednesday. Thanks, Samuel.
Thank you, everyone.